So ECG in WPW. Now, see, you should know how to diagnose WPW. ECG in WPW is one thing. Let's go to the ECG now. There will be a short PR interval. This will be short PR interval with a narrow QRS complex. You see, this QRS complex will be narrow, short PR interval. With narrow QRS complex may be normal, but short PR interval with wide QRS complex may be consistent with WPW. See, it will, what he's telling, there will be a short PR interval and there will be a wider QRS complex in WPW compared to normal. Okay, because I think this delta wave which comes will make the QRS complex little broader than the normal ECG. So short PR interval with wide QRS complex may be consistent with WPW. A wide QRS pattern consists of, what does this, why it is wide? Let's see now. A wide QRS pattern consists of a upstroke or downstroke forming delta wave. We call it as this upstroke. If you can see here, this we call it as delta wave. And the PR interval, this PR interval will be short. It will be less than 120 milliseconds, and QRS, normally what did we study? QRS normally is less than 0.12, right? But here you see what he's telling, it will be more than 120 milliseconds and there will be delta wave. The delta wave. Then this is one of the ways you diagnose WPW. So again, let's so there will be a P wave, short PR interval, there will be a delta wave, and wide, comparatively wide QRS complex compared to a normal ECG. And it will be more than 120 milliseconds and you'll have a delta wave. This is how you identify an ECG of WPW. So in this ECG, you can see he is showing the delta wave for you here. The delta wave. There will be short PR interval and a delta wave. This delta wave will cause comparatively wide QRS complex. So let's move on to the treatment of SVT and WPW syndrome. So there's two things here, acute attack and stable. So usually what do you do? Vagal stimulation. Vagal stimulation by ice water in children and ice bag over face in infant. So what do you usually do? You cannot put the ice water on infant's face. So you will just place a ice bag over the face of an infant, and for the children you can splash his face with some ice water. It will cause vagal stimulation. Vagal stimulation by ice water or ice bag. Ocular pressure never be performed. I don't know about this ocular pressure. He's telling you never be performed. So for older children who can do it, like blowing of uh, a straw, all those things, it is for the older children. Well, you can use Valsalva maneuver, but for the smaller children who cannot do, you will either place ice bag on the face, or you will put ice water on their face. Carotid massage is usually ineffective. So the best thing is either place the child in put ice water on the child's face, or place the ice water bag on the child's face, especially in infant. And another for older children, Valsalva maneuver. Better avoid carotid massage, because usually if it is performed, it should be performed on one side, not on both the sides together. But avoid it. It is written here ineffective. That is the Valsalva maneuver. If this measure fails, then you will go for adenosine rapid infusion, because adenosine may initiate atrial fibrillation. A DC cardioversion must be near at bed. So always you should have a one more thing. When you give adenosine to stop SVT, there can also be an AF. There is a chance. So you should keep your DC cardioversion near the bed. Next is the calcium channel blocker can be used in children but contraindicated in infancy due to hypotension and cardiac arrest. So adenosine rapid infusion you will do. Another thing is the calcium channel blocker. Leaving the side effects, let's go step by step. The first thing, when there is an acute attack, you will try for vagal stimulation. It will be keeping an ice bag over infant's face or putting some ice water on children. For the older children, you will ask to do some Valsalva maneuvers like blowing of straw or something. Then if these measures fail, you will go for adenosine. But when you give adenosine, there is a risk of development of AF. So you should keep the DC cardioversion near the bed. Now, other options is the calcium channel blocker. Can be used in children, but contraindicated in infancy due to hypotension and cardiac arrest. Urgent situation and unstable patient. This is for stable patient. For urgent situation with unstable patient, you will do DC cardioversion. If it is from non-WPW, the cause is non-WPW, then the chronic treatment will be, you will put them on beta blockers and digoxin.